welcome to Kim Talks Resilience, where we share stories of insight and inspiration in life, love, and business with resilient women from around the world. Speaking with authors, entrepreneurs, founders, and coaches to learn their strategies for a more resilient life so we can all build the life we love. I'm your host, Kim Hayden. Alrighty, welcome back to the show. I've been really fascinated as of late. We've been talking a lot around AI out there and all the biotech and everything that's going on. And they're working to hack our life to a longer longevity, but it's only going to be so good if we don't have our equity within health. So, I'm excited today to have Dr. Mauvareen Beverly in the studio. She is an executive level physician with 20 years of experience advocating for improving patients' engagement in cultural competence for all populations, and especially the African American communities. In 2021, she received the Excellence of Medicine Award from the Bronx County Medical Society. Dr. Beverly is a member of the National Medical Association, and her article, Patient Engagement and Cultural Sensitivity as a Strategy to Improve Health Equities, the Solutions Are Simple as They Are as Complex, was published in the journal in 2022. And she has literally, if I sat here, there was another 10 published and recognized articles. This gal is a wealth of knowledge, but really it comes down to she is embarking on her journey of being a published author. Dr. Beverly, her first book, will be published on Juneteenth, which is the federal holiday where they ended slavery in 1865. It's also her birthday. So what a great gift. What a great gift to give from herself to the world for her birthday. The book title is 9 Simple Solutions to Achieve Health Equity, a guide for healthcare professionals and patients. This is a really important conversation. Welcome to the show, Mauvareen. How are you?
I'm great. Thank you so much, Kim, for inviting me to be on the talk today.
Well,
And
I am excited. I know that women like us, women who are, that 45 to 65 kind of range, that our expertise is what is our legacy we leave the world.
yes,
Right. And I love the fact that you've gone through the endeavor of putting this into the book. But if you could first share with us a little bit of who is Dr. Beverly, who is Mauvareen, and where are you coming from?
okay. Good evening, everyone. My name is Dr. Mauvareen Beverly. I'm president currently of Mauvareen Beverly MD PLLC, Patient Engagement and Cultural Competence. I'm going to divide myself up into 2 areas. From a personal perspective, I am married to my husband of over 40 years, and I have 3 amazing sons. And I refer to them as my favorite firstborn, my favorite secondborn, and my favorite thirdborn. And in addition to that, I've now joined the Grandma Club. My grandson is now 7.5 months. On a professional side, I have been in the practice of medicine for over 10, 15 years. I'm trained in internal medicine from New York at Harlem Hospital, Columbia Presbyterian. And over the course of the last 10 to 15 years, I was in charge of developing the first care management program in 3 hospitals in New York City. And it is that experience when I created the concept of the bridge team, where the team was bridge the gap. Whatever the gap is, we were to bridge the gap. And it's from these types of conversation with patients, which is over 1,000 patients, what I term as the stop in my tracks moments. When you think you have a process and you're ready to implement the process, and you have these stop in your tracks moments, and they all came from patient, which led me to develop boots on the ground, simple solutions to health inequity. And
Yeah, I think that this is a really important conversation of how we communicate. I think everything comes down to communication. And would you say that that's probably the biggest challenge we're facing?
I think the biggest challenge we are facing is the lack of human value, which leads to poor communication, particularly towards the African American population. So if we were valued the same as other ethnicities in this country, we would not be experiencing, we would not be discussing health disparity right now towards African Americans. But the history of the atrocities that African Americans endured over the course of slavery and when it ended, it's what contributes significantly to the continued lack of human value. And my team, the concept of the bridge team, and the bridge team was made up of everyone. We had everybody, all races. We had Caucasians, we had African Americans, we had Caribbean, we had Spanish individuals. We had a Hasidic Jewish pharmacist who was amazing. And we all came together to bridge the gap in understanding the concept of the common thread, first and foremost, the human experience. That's one of the simple solutions. What do I mean by the common thread? Once accurately diagnosed, there is no human being on planet Earth could give it back. It applies regardless of race, ethnicity, country of origin, socioeconomic status, language spoken. Once accurately diagnosed, there's no human being on planet Earth could give it back. The millionaire can't say, "Oh, I'll give you $1 million to take the cancer back." "Oh, that's not enough. I'll give you 5 million." And this is where the common thread binds us all together. And if health system could recognize the common thread, maybe we could be a little bit less judgmental and more empathetic for the patients who are in our hospital bed. And the other point that I want to raise is that the bulk of us taking care of patients never laid in a hospital bed. And those that do are women delivering life and patients to a certain degree trying to prevent death. And that's one of the common thread, one of the simple solutions. And it resonated with my team. And the other thing my team had to do, the bridge team, bridge the gap. I'm sure, I don't know if you heard the word non-compliant, and everybody's non-compliant. Now there's a nicer word, non-adherent. But there's no why question. And what do I mean by that? So we don't know why John Brown didn't take the medication, but we're going to refill the same prescription he didn't take, and we don't know why. And non-compliant / non-adherent written in the medical records 2 or 3 times, that patient is under the help bus. No one cares about that patient because the problem is you're the problem. And my team had to ask why. Because if they didn't ask why, they said, Dr. B is going to bug out. So I give you an example, and that's why I'm so committed to getting that information out to patients. Very typical story. 60-year-old African-American male recently diagnosed with congestive heart failure, returns 2 weeks later, heart failure decompensated due to non-compliance. So when that patient gets admitted up to the unit, you think anybody's going to care about that person? And one of the nurses who are not on my team said, so he just got diagnosed with a life-threatening condition and won't follow directions and take his medication. I got other things to do. And my team had to ask why. Why didn't you take your medication? I can't take the water pill, which is a diuretic which flushes excess fluid out the body so that the heart could pump better. And why can't you take the water pill? And Kim, I'm glad you're sitting down, because guess what he said? Because I drive the number 7 train.
So does it cause people to go urinate more? Is this a problem?
Yes, it makes
That's what it is.
Exactly. So you can't say, oh, the train is delayed because the driver has to find a bathroom, right? So we said, when is your shift? He said 11 p.m. to 11 a.m. What do you do when you get home? I do some chores, I make breakfast, I take some of my medication, but if I'm going on my shift, I don't take the water pill. So they brought in the cardiologist, who was same, to be honest with you, almost dismissive as well. He said, okay, once you get home, take the water pill. Be aware it may wake you up at night. I mean, wake you up during the day, but by the time you get to your shift, you'll have less of a reason to urinate. But to the degree that you do, we're going to give you a cubicle so you could use it in the private space.
Oh,
And
yeah, finding out the why.
yeah,
Um,
let me just tell you what the patient said. I'm sorry. So guess what the patient's response was? If I knew I had to choose between peeing and breathing, I would have chosen breathing.
so it's just working with them to
Yes.
working with people to find solutions. And I absolutely agree that um, disease on a whole does not discriminate, whether you're wealthy, whether you're poor, whatever. Like Steve Jobs, he couldn't stop it, right?
Yeah.
And he changed our communications game. However, I do think that, and this is me poking a little at something that neither one of us have any control over,
Mhm.
the way that the American medical system is set up. I think it's really a challenge for an average person to navigate it, to stay insured, to stay ahead of their health, um, because I think that the insurance system is set up to say no. And I know that with it being tied to people's employers, that there's a discrimination there also as to how you gain access to quality care. And we see this all the way from African American women have a higher rate of miscarriage.
Mhm.
There's so many things. So when if we're going all the way back, if we're really looking at this, the system in itself does not serve everyone. And so you're coming in to bridge a gap of communications to keep the human service in place. And that is so needed. Um, because I don't know if we can fix the system. I think the system is what it is. I don't think the United States system will ever change.
Yeah.
Um, so we have to get better at speaking to each other.
Oh, absolutely. I totally agree. The only thing I would expand on, it's not just maternal health that's the problem, which is the focus right now. And it's very important, don't get me wrong. It's horrible what's happening to Black women giving birth, whether they are poor or whether they were Serena Williams.
Yeah.
So this is where it's not necessarily about finance,
Yep.
affordability. But what I want to expand on is that it's usually in every disease category. Patients with sickle cell disease, they're treated horribly when they're midway through their life expectancy, and they have to refer to themselves as sickle cell warriors. Now, how many other diseases and communities that have a life-threatening condition that they have to be warriors when they're midway through their life expectancy? What does that tell you about the health system? Cystic fibrosis patients, predominantly in the white communities, they don't have to experience that. And the other thing that I realized from my experience is the elderly Black population is not a part of the cultural competence conversation.
Yeah.
And that was humbling when I was in charge of the congestive heart failure readmission prevention. When Medicare said, if you came back in 30 days, we'll only pay for one admission, whereas prior to that, this was around 2014 or so, they would pay for all admissions.
Yeah.
And when my team, again, it's all came down to high human value. And I looked at the concept of the perception versus reality. Because if your perception of me is not my reality, my health is going to go south. But if the perception of me is the reality is the same, good, bad, happy, or sad, we have an opportunity to collaborate and improve that person's health outcome. And one thing I also realized when people talk about cultural competence has to apply to American-born physicians to foreign-born patients, but also foreign-born physicians to American-born patients. and American-born physicians to American-born patients who are different than themselves, because it has to span that whole gamut. And in speaking to the elderly, obviously heart failure is age-related. 95% of the cohort of patients were between 60 and 92. And in Brooklyn, there's a large Caribbean and African American population. And the Spanish population was not from typical Puerto Rico or Dominican Republic or Mexico. They were from Panama. And under colonial rule, the British sent the English-speaking Caribbean population to Panama to do what? To build the canal. So phenotypically, they look black, and their names are not the same as Maria Rivera, or their names are English and Spanish. Ronaldo, Austin, Antonio, Martin, you know. And
Ah.
and then I realized 95% of the cohort of patients that were African Americans were from the Carolinas. And I'm saying, why is everybody from the Carolinas? You know, Virginia is sort of down the street from us. How come we don't get anybody from Virginia? And again, I had to do the research and the migration history. And after the Emancipation Proclamation, when Blacks had their first representation in Congress, their communities started to do better. They built schools, they built churches, they built businesses. The plantation property owner went south because nobody was picking the cotton. And over the course of time, the Ku Klux Klan came in and burned the whole damn place down. And they moved up and they came up the coastline to New York. And if there's even a documentary, the Wilmington Massacre, that
Yes, I watched that one. Yes.
Yes, and in speaking to the patients, I needed to know who's Caribbean and who's African American, because from a cultural perspective, Kim, is what I referred to as the lookalike syndrome.
Yep.
Because I look like you, and I may be in the same location or geographic location, and we are similar, but I need to understand the cultural differences between the population. So when I've done presentation, and I've said, and I bring this up, and I said, okay, what an example? Go tell a British person they're Irish and see how far you get. Go tell a Chinese they're Japanese and see how far you get. Go tell a Nigerian that they are Ghanaian, or Indian that they're from Pakistan, or Trinidadian that they're Jamaican. And most important, go tell a New Yorker that they're from New Jersey and see.
Well, and this brings me to I interviewed a doctor that is in epigenetics and what is it? You're a doctor, you'll know what it's called. Where they look at like your gut health and all of your like DNA structure as to what you can eat. And they said that your where you come from, even 100 years ago, can impact how your body processes different nutrients and different foods and different medications. And I didn't even think about this, right? But it's the same thing as when I say, well, I'm Irish and German, so obviously we're all going to be heavy bottomed. You know, so we talk about the potatoes and the starches, you know. But then there's also then that 7 generations of trauma. So when we layer in our genetic, our core genetic, and then we layer in that 7 generations of trauma. So we look at how it goes through the body. And I do believe in this. Like I truly do believe that, be it a psychological or a physiological, it is there because I can tell you stories that my grandfather shared with me. Exactly. Right. So we take all this and then we expect modern medicine to magically fix everything. And that's why I like how you're speaking to the equity in health. It's like understanding how to speak to each other so we can find solutions.
Absolutely.
Do you feel this has been challenged with COVID? Because I know that here in Calgary, I have several friends who were in the medical industry that are no longer. They're no longer nurses. They're no longer doctors. They're done. Like they got completely burned out, and people were mean.
Yes.
They were mean. And I know it's scary. I know things are bad, but it's kind of like, you know, you hit turbulence, you don't go up and kill the pilot, right? You don't go, and that's why they have a lock on the door. But you know what I'm saying? Like people got really aggressive. So a lot of the people in our medical industry have become exhausted.
Yeah.
Um, what are some ways from the other side, from the patient side,
Yes.
can we better advocate on behalf of ourselves while keeping our manners in check and being respectful to the professionals who have endeavored to get
Mhm.
their education and take on all the debt to become educated
Yes.
and work tireless hours, right?
Mhm.
Every person I know in the medical industry,
Mhm.
they don't shut the door, go home, and never think about it.
Oh no.
They are thinking about those patients because they truly are there for a reason. How can
Abs-
we? How can I be a better patient, be a better advocate for my
yeah.
health?
So I think that's a very important question, and it just brings me back to once you finish medical school, we had to take the Hippocratic Oath to do no harm, and that is embedded in all our brains. And I think to how to better communicate with patients from a physician's perspective, but also from the patient's perspective. I'll give you an example, which I find that's what I'm saying. If we don't understand the cultural norms of what's happened to, particularly, and I'm focused African Americans, then we will not be able to have a better communication. Why do I say that? So the heart failure, she was 80, and I went in to see her, and the team had to ask where you're from because I need to know whether you're Caribbean, African American, or Panamanian. And she said, Monday morning, 9 o'clock. When she said, my parents were a step away from slavery and my grandparents were slaves. Was I expecting that Monday morning, 9 o'clock? And I said, I'm trying to, because my next question before she made that statement was to know, she said initially she was from the Carolinas. And my next question was going to be, are you visiting New York or do you live here? Because the transition of care would be different if if you visit in and you got sick or you live here. So I said, tell me about it. And some of them spoke in codes. She said, my family picked cotton on a plantation that was not ours. And we had to get up at the crack of dawn and pick 300 to 500 pounds of cotton. And then she said we had to walk 10 miles to a segregated school. And I'm thinking, how do you walk 10 miles? We can't even go 5 blocks without calling an Uber, you know? So I said, how do you walk 10 miles? And the body language came changed and the tone. She said, well, if you want an education, you had to. It's almost like, what part of this don't you get, stupid? So
Yep.
I said, did you have to walk back? She said, yeah. No, the principal in the horse-drawn carriage took us back. And we had to get back before dark, before the Ku Klux Klan. I said, how old were you? She said, 10 years old. Could you imagine? She continued her education, went to Voorhees College. It's a 2-year black college in South Carolina. I had to look it up. She came to New York in the 30s, married. Most of the men back in the 30s in New York were either doormen, they worked in the subway, or they worked on public transportation. And I don't know if you ever heard of this school, Stuyvesant High School.
No, I have not.
It's a excellent school. It outshadows public and private schools in New York. And her children were 2 of 5 black children to integrate Stuyvesant High School. She continued her education, became a dietitian. And I said, do you mind me telling you, when did you retire? She said, in the late 90s. I said, do you mind telling me how much you made? She said, $200 a week, but others made more. Read between the lines. And
Yep.
the interesting thing in terms of communication now, and I said, because you have Medicare, your home care services, I'm going to offer home care services. And I'll never forget her response. She said, I don't want anything that's not mine. She thought I was giving her a handout. And I tell my team, when you make a mistake, whether you meant it or not, apologize. Just say, oh, I'm so sorry. Maybe I didn't explain it the way that I should. I said, everyone that has Medicare, I didn't use the word entitled. everyone that has Medicare, home care services are for everyone. She said, everyone? I said, yes. And she said, okay. So when you ask about how do we communicate better, if we don't understand this individual, how far do you think we're going to get in terms of improving our health? And I think patients, when it comes to what patients could do, when it comes to the word non-compliant, and I tell you in my book, 9 Simple Solutions to Achieve Health Equity, a guide to healthcare professionals and patients. One of the solutions for patients, it says for healthcare professionals and patients, if you're in the hospital or you go to your doctor or you're in ambulatory care and the doc and asks you, did you take your medication and did you follow direction? And you say no, wait a couple of seconds. And if you're not asked why, say to your doctor, do you want to know why I didn't do something? And the next statement that the patient I am really want patients to do is to say, please don't write the word non-compliant in my medical records without asking me why, because it could affect my health outcomes.
Yeah.
And when we asked why, we were able to decrease congestive heart failure readmission initially when we started from 30% to 18.7% in just about 2 years. The
Wow.
population didn't change, the clinical care, the so-called social determinants of health didn't change. The same population in Brooklyn that was in the 30% was in the 18.7%. What changed was the heightened human value, not to be judgmental, never use the word non-compliant without asking why, and try best to see it from the patient's perspective. And because of that, I think we had a better communication. Patients felt very comfortable in telling us whatever they were concerned about. And the average, and the other thing I realized, we have to understand surveys, and most surveys are either given to doctors or they're given to patients, but they have the same questions are never given to both.
Yeah.
So one of the surveys that I did, why don't patients take their medication? And that's from the ambulatory care, inpatient, the ED, doctors, nurses, social worker. Everybody said cost.
Yeah.
Makes sense, right? So,
Absolutely.
but,
Well, I
let me just finish. When we asked the patient, what if I told you that not one patient mentioned cost?
really,
Yes,
really,
guess what they responded? Why don't you take your medication? Now, these are patients with heart failure taking about 5, 6 medications 3 times a day. We don't take our medication because we think we're taking too many medications.
oh, hilarious.
Yeah, and so we brought in the pharmacist who was amazing, and she was able to cut down some of the medication. Because if you're going to design the system based on cost, because one of the doctors said, what do you want me to do about it? Call the social worker. It's going to fail. But if you hear it from the person who are actually taking the medication, then you will now be able to include the patients as part of the solution. And currently in health systems or in anything you do to look at disparity, the patients are not included in the solution. And in my book, the patients are the drivers for the stop in my tracks moments that cause me to change the whole trajectory of what needs to be done.
And I love the fact that you are a medium, even though it's interesting because you are over, the 50 years of age. So this is when we all start aging and stuff starts going wrong. It's like having an old car, got to keep it on the road a few more years. But you also have the professional awareness and the insight. So taking that and bringing that together is I mean, I personally I do think that some cost of medications like
Yes.
insulin and such is just ridiculous. And I agree that the for-profit, the mental for-profit aspect
Mhm.
that the medical puts or the pharmaceutical or whatever, I'm splitting hairs, but the for-profit aspect being put onto a human life
Mhm.
is really we shouldn't be quantifying people based on money.
No, absolutely. And, you know, and just to reiterate, for the Black population, it's across all socioeconomic. So I can't just limit it to money
Yeah.
because it's across all socioeconomic groups. Prince George County, right outside of DC, is a very affluent Black community. They had the highest COVID death rate
Huh.
during that time. Brooklyn, New York, has 3 public hospitals, private hospitals, a state hospital. They have about 7 or 8 hospitals. So whether you have insurance, you could go to the public hospital system. Whether you choose to go to a private hospital, and Brooklyn has a large multi-ethnic
Yeah.
groups. And the interesting thing is people mention about access to care and transportation. The subway system and the transportation system, the buses run through Black and white Brooklyn, you know.
Yeah.
But again, the Black population had the worst health outcomes when it came to COVID.
Interesting.
No, yeah. So when I look at it from this perspective, so what is the driver? And so when I do training, it's on patient engagement and cultural competence.
Yeah.
And at the end of my training, and regardless of, I did it at Institute of Healthcare Initiative, I did it at different hospitals, Northwell Medical Schools, Toro Medical College. And after the presentation, I asked, one of the survey question number 7, after hearing Dr. Beverly's presentation, would it change the way you interact or communicate with patients? 90+% said yes.
Excellent.
And I have that
Excellent.
data, yeah, because when you solve the simple, it doesn't have to escalate to the complex.
I love that. When you solve the simple, it doesn't have to escalate to the complex. That's a beautiful statement and how true it is.
Yeah.
You know, somebody said, I love the fact that you're bringing this down to communication and understanding. At the end of the day, that's what I'm hearing is the core to your messaging. We have to better communicate and we need to have understanding within this, when we're speaking to people. I just look at everybody and I'm like, I find that a lot of we're so fast paced in this world that we need to sometimes remember to slow down and
Yes.
get the details.
Yeah.
Get the details. Where will we got your book up here. Your book comes out June 10th. So that is June 13th.
19th.
19th. I thought it was the 13th. No, I'm sorry. I'm sorry.
No
We'll
problem.
edit that. Pardon me. Oh, I have had a cold going on yeah, Calgary's weather is up and down. We had snow 3 days ago, and today it's warm. So I'm going through all this. So June 19th, I apologize. And I do know what Juneteenth is because I'm from Wichita, Kansas. And I know that a lot of Tulsa was, there was epicenters down in through that area because what was it? Black Wall Street was. Yes. Yeah. Yeah. And that's when I think a lot of Juneteenth was actually starting to be prevalent, right?
5. Yep.
Yeah. So yes, folks, there was, and unfortunately, the United States has only bombed its own soil twice, and once was in Oklahoma on Black Wall Street, and once was in, I want to say Boston.
Mm-hmm.
Yep, Boston. Yeah. So no, I know my history, just not the exact dates, but I can't remember my husband's birthday, and we've only been married 30 years. So tell me where we're going to be able to get your book and what your goal is for the reader.
The book is going to be on Amazon. I'm working with the organization about my book. We're just finalizing the edits, and they're working on the back cover, and the front cover is done. And I just got 2 amazing acknowledgments from the Peekskill NAACP chapter in New York, as well as the New York State Commissioner of Mental Health. And that's going to be on the back cover. I will keep you posted I'm supposed to have a conversation next week to decide to let me know how the book is going to be um, sent, completed, and the marketing and where people could obtain the book. But definitely it's going to be on Amazon as well. So I'll keep you posted as I get more information. And what do I want to accomplish, you said? Yeah.
What do you think? What do you want the reader to take away from this?
I think what I want the reader to take away from is that all individuals are human beings, and do not let anyone diminish your human value. And in healthcare, where it's a scary situation with certain diseases or just understanding, and what I would tell the doctors, realize that you're never laid in a hospital bed. So before you judge me about what my condition is and what I could do, maybe you could be more empathetic and have a better communication and ask about. And one of the things I mentioned, my fears, what are you afraid of? Because you could see how fear could lead to non-compliance, right?
Yeah.
And from a patient perspective, you are valuable regardless of what your socioeconomic status is, your race, gender, religion. You are of value to yourself, to the community you serve, to your families, and to your friends. And if you're having a difficult time and have the doctor communicating with you, ask to speak to the doctor and said, I know you're my doctor, but I need you to understand and listen to what my concerns are. And if you could do that, I think it would help me be able to understand my medical condition, because it's a complex issue, and be able to be a better collaborator in terms of being a part of improving my health. I think that would be really important for both sides to recognize um, the individual and to understand where each person is in the acceptance of the disease. That's another, because if I'm planning a vacation, Kim, and I'm going with my family on vacation and I did my mammogram and the mammogram is positive, I may not even know who I am at that point,
Yeah.
you know? And I think these are some of the things. And so when a patient doesn't show up for chemo, don't start blaming and say the patient don't care about themselves. You might want to share with your doctor if there are any fears that you have in taking the medication. For the doctor, you may need to understand that you have never been diagnosed. So maybe it's gonna, the time it takes for me to accept my disease. And I created it's in the book called the SPOT methodology. S, speak to patients and families. P, pacify fears. O, outline what's important to the individual. And T, take into the time it takes, understand the time it takes for somebody to accept the disease. And it's on both sides. So what I'm
Yep.
hoping, if both could use the SPOT methodology, you know, then it could be a uniform process that will, eliminate some of the misconceptions or the perception of who the doctor is or who the patient is, because we both share that we care about us as human beings.
Absolutely. I mean, most people that go into medicine because they want to make a difference.
Yes.
So we just have to keep that communication and use the spot method to bring clarity and support to whatever those challenges are that you're facing. If you have any questions or if you wanted to reach out to Dr. Beverly, just go over to LinkedIn and you'll be able to find her, Mauvareen Beverly, MD. And watch for the book. I think the book will be good, just even to share with anybody that you have that is going through a challenge, a significant challenge, or significant diagnoses. This could be a great book, even for what we call the sandwich generation, those 40 and 50-year-olds that are navigating for their parents. Let's all get talking. You know what my grandma always said? Kimberly Joe, if you don't have something nice to say, don't say anything at all. And let's just be a little bit kinder and keep the communication waves open. Ask the right questions, share the information. Thank you, Dr. Beverly. You are a rock star, and I can't wait till you let us know when your book is ready to get.
I will definitely do so, Kim, and thank you so much for
Abs-
inviting me to be on your talk show. I really appreciate it.
absolutely.
An honor. It's an honor. Thank you so much.
Absolutely. All righty, folks. You know what? Like I say, give yourself some grace and be good to yourself. You deserve it. I promise. I promise you. You deserve it. Thank you for joining us here today at Kim Talks Resilience. I'm your host, Kim Hayden, and I'd love to invite you to our resilient community at resilientgift.com. That's resilientgift.com, and we'll send you our magazine and tickets for upcoming events and all sorts of cool things we do here. So be sure to keep watching, and you know what? Don't forget to like, subscribe, comment, and share, because we all know that sharing is caring.